Advocates have filed a discrimination complaint with the Maine Bureau of Insurance against Harvard Pilgrim Health Care for offering insurance plans that they say discriminate against Mainers living with HIV.
The complaint focuses on the carrier's plans for 2025 that do not cover several HIV drugs, including the most widely prescribed treatment in the U.S. News Center Maine's Vivian Lee reports.
More than 2 decades ago, treatments for HIV were a nightmare involving up to 20 pills a day.
One pill once a day was once the dream, and we're living that dream now.
Dr. Stephen Rawlings treats patients with HIV and serves as the medical director at the Gilman Street Maine Health Adult Specialty Care and Maine Health Infectious Disease. He says treatments today render HIV undetectable in the blood. The most popular, Biktarvy, allows patients to swallow a single pill once a day.
About 50% of people who have HIV taking it, and it controls their infection.
However, about 100 patients with Harvard Pilgrim Health Care plans were notified this fall that Maine plans for 2025 will only cover 2 of the 4 medications recommended by national treatment guidelines. That includes removing Biktarvy, the most widely prescribed treatment for HIV in the country. Because of out-of-pocket costs, some patients will have to find alternative treatments or switch carriers, and time is running out. The deadline for enrollment is Sunday.
The cash price of some of these medicines is on the order of $4,000 to $8,000 a month.
Dr. Rawlings is one of several Maine physicians who signed off on a discrimination complaint sent to the Maine Bureau of Insurance. Filed by the HIV plus Hepatitis Policy Institute last month, it charges that Harvard Pilgrim's 2025 plans discriminate against its members in Maine with HIV.
If one insurance carrier can do this, what is stopping other insurance carriers from doing it? And that, especially when it comes to the Affordable Care Act.
Katie Rutherford is the executive director of the Franny Peabody Center, which provides resources and assistance for HIV patients. She believes that cuts in coverage will mean patients may fall through the gap. Harvard Pilgrim spokesperson Kathleen Michaela tells News Center Maine in a statement, quote, current Harvard Pilgrim Health Plan members will see no changes in coverage and can continue to take these HIV medications. We have developed a process for new and future Harvard Pilgrim members for coverage to be considered for the medications per our continuity of care guidelines, unquote. In a statement from the Maine Bureau of Insurance, Superintendent Robert Carey says the Bureau is taking the complaint seriously and is working to resolve the matter. Quote, we will also make certain that people with HIV or any other condition are not unfairly discriminated against or forced to switch insurers to maintain their course of treatment, unquote. Under Maine law, Dr. Rawlings and other providers can ask for a formulary exception if the non-covered treatment is medically necessary. He hopes it doesn't come to that.
Or let's just keep these medicines on formulary so that my patients have access to them.
And ensure Mainers with HIV get the treatment they need. In South Portland, Vivian Lee, News Center, Maine.
Officials with the Maine Bureau of Insurance have not announced if Harvard Pilgrim Health Care will be required to cover the HIV treatment regimens next year. Similar complaints were filed in New Hampshire and Rhode Island.